What does dying well mean? Well, it means the same things as living well, ageing well and then dying well. The main sort of features, I suppose, that you see, or parts of the dying well, include good pain and symptom control, I guess good preparation for death, being aware that it's coming, accepting that it's coming and getting organised for what happens when that occurs. The other things through the literature, and again seen in my own practice, is clear decision making as people approach dying, and usually that's kind of informed by really clear goals about where we're heading and what we're doing them for, what we're doing things for. And also informed by a clear ethos on behalf of the person who's experiencing the dying process. That helps us make good and clear decisions, and that helps the person die well. There are sort of other more existential and broader kind of things, I think, that are both in the literature and experience. One is sort of a sense of completion, that life has fulfilled its meaning, that there is a legacy to be left. There's a life review sort of process as part of that. But that also, completion has other components to it, most particularly sort of community type components, so the gathering of friends, communion with loved ones, resolution of interpersonal conflicts and things like that. And the last one is really kind of rings around this sort of famous phrase by Dame Cicely Saunders when she first started developing palliative care in the UK, and that is this sense of whole person worth, that people feel worthwhile as themselves in their completeness, in their wholeness. And she sort of has this famous phrase which is, you matter because you're you and you matter to the very end. And I think some of those things integrate with that, but people talk about that. They want to be seen, to be known, to be understood, and to be appreciated as part of how they've lived. And I think that a sense of that really helps in the dying well context.